Thank you, everyone. Good afternoon, buenas tardes, and happy International Women's Month. An amazing time, and love to see you all here today. Thank you so much for joining us. I am Sheila Och, and I'm the Chief Public Policy and Equity Officer at Lowell Community Health Center. I'm really happy to see that you have joined us for what is our very first Health and Wellness of BIPOC Leaders series. First, I want to thank our partners in this for hosting this, the Center for Hope and Healing, Enterprise Bank, and Lowell Community Health Center. This event is also possible via our Reach Lowell program, which is funded by the Centers for Disease Control and Prevention and led by Lowell Community Health Center. Reach Lowell seeks to eliminate disparities in the Southeast Asian and Latinx communities as it relates to diabetes, and it's done in collaboration with all the partners that you see on the screen. So thank you to all. This Health and Wellness series was created in response to conversations that have taken place in our community and within Lowell Community Health Center, focused on the importance of our wellness, our health, and specific considerations we need to take at all levels and in all spaces. We know many organizations that are represented here today are working towards racial equity within your organizations and within our community, working towards community empowerment, towards advocacy, all while providing crucial services to our community. For all that, we thank you. Please know that today's conversation creates, in the words of my great colleague, Ruth Ogembo, a learning space. A space to share experiences, to learn, to validate, to reflect, all with the aim of creating stronger organizations and systems, a stronger community, all while supporting the resiliency of many of our BIPOC leaders. We ask that as we enter this learning space, we maintain a curious stance, that we be present and engaged, that we own our intentions and tend to impact. We own our own experiences. We listen without judgment, and we share airspace. Before I introduce our panel's moderator, a couple of housekeeping items. First, we're going to place everyone on mute. And the second is we're going to encourage all of you to use the chat box for questions and comments. And I can already see we're doing that. So thank you. With that, I have the great pleasure of introducing our panel moderator, Isa Walda-Gorges. Isa has been the executive director of the Center for Hope and Healing since 2012. Prior to this, she worked in the anti-violence field for 20 years, holding several statewide and national roles in the movement to end sexual and domestic violence. Isa is a well-respected leader and a national trainer. She is well known for her dynamic training style and teaching skills. Also known for her activism in the areas of racial disparities and her unwavering commitment towards racial justice. She has authored many different articles on a variety of topics, including family-centered practice in child welfare, racial and ethnic disproportionality, and immigration. Thank you, Isa, for all you do, and thank you for being here. And with that, I will now hand over the virtual mic.
Thank you, Sheila. Much appreciated. I want to applaud almost. So I am thrilled to be here with you all today. I want to thank Linda, Sheila, Mercy, and Ruth, and all of the wonderful women of color at the Lowell Community Health Center for your leadership, for your partnership, and for this gracious invitation. You all, everyone who's participating today is in for a wonderful afternoon of learning and hearing, amplifying the experiences of women of color leaders in our community. I really appreciate you all putting this event together and amplifying the voices of women of color leaders. It's not something that happens often. It's not something that happens often enough. So I will just say that my experiences as a Black Latina woman in leadership has taught me how precious and important these spaces are. We know several things, right, that we're not going to reiterate for you today. That women of color are often, the endangered species in our sector, right? Catalysts, which is a organization that studies nonprofits across the country, finds that about 50% of women of color in leadership plan to leave their employers in the next year or two. So planned exits. We also know that while there's been an increase of women of color in higher education, we're getting better degrees, we're getting MBAs, we're getting PhDs, yet we're not getting advanced leadership positions. There's still only about 12% of people in management level or C-suite positions, as they call them. Women of color, Black women particularly, have the greatest wage gap than any of our counterparts. Right? So this series is so important because what we know is that our health and wellness is at risk right now. You'll see probably a lot of folks on social media say, check in on your strong friends because we're not doing well right now. Between the pandemic, a pandemic of racism, right, and the disproportionate impact, it's a real challenge. So this panel today and the experts and the leaders you're going to hear from really speak to what is needed in our time, how organizations support the wellness of their women of color. Individually, I can tell you this from my own experience that we experience greater and greater isolation the more we move into leadership positions. We experience microaggressions and systemic macroaggressions that impact our ability to be well and to do our jobs well. So there's a need for allies to be with us in this work, to create organizations that help care for us as well as we care for ourselves. Affinity spaces where women of color can be in safe spaces and can receive support. And many other things that I'm sure you're going to hear about during this afternoon's panel. But before we move on any further, we do want to share a message from one of our panelists who unfortunately couldn't be with us, Vanna Howard, our Massachusetts State Representative from the 17th Middlesex District.
Hi, my name is Vanna Howard. I represent the 17 Middlesex District, consists of Lowell and Chelmsford. I am so sorry that I cannot be with you all this afternoon as the House is taking up a full formal session on a bill. So I am so sorry and I wish everyone luck. And thank you to the collaboration of Enterprise Bank, the Center of Hope and Healing, and Lowell Community Health Center. We're not doing okay in terms of the current state of the health conditions, resources, and outcomes of our Black, Brown, Indigenous, people of color community. Certainly, we also recognize that mental health issues exist everywhere amongst every group of people. These mental health issues have been and are still largely ignored, hidden, swept under the rug. It's a tough topic everywhere that a white person's health issues and outcomes are far more favorable than the BIPOC community, and most especially regarding mental health issues. We need to devote equitable resources and remedies to treat these conditions in those neighborhoods, schools, and work settings. Health needs and outcomes of the people in these communities, always worse than the white community, can be addressed with an equitable devotion of our time and resources. I'm brand new and have much to learn on Beacon Hill to help my district. However, I did purchase some new books online, and now I'm trying to find the time to start them. Look, we're stuck inside for more than a year now because of COVID-19 and because of the winter weather. But this is rapidly changing, and I believe my physical activity level will increase in the days, weeks, and months ahead. Hoping soon also to get outside with the family and long overdue weekend excursions. Thankfully, we now have vaccine. And when everyone is vaccinated, that will improve our health and wellness. And when we can then finally start to be and hug each other again. The House has rules and regulations on these matters for the staff and personnel here. And I would encourage an effort to prioritize the mental health aspects. All legislation I'm going to be involved in sponsoring and writing is going to make sure there's equity in that legislation where it impacts mental health or otherwise affects the mental health of people in our community. While any answer on this question would depend on the particular organization and issue, it can be assumed that current BIPOC employees there have been underserved by the available medical and mental health providers. As a consequence, any organization should see to it that access to these caregivers in place for them. I believe firmly that a single payer health plan would move us significantly forward towards that goal. Thank you, and be well, everyone.
We are so grateful to have had that message from our representative. Now I'm going to introduce our next in-person, somewhat, panelist, Kathy Mercado. Kathy is a housing counselor and now the deputy director at Merrimack Valley Housing Partnership. She coordinates classes for homebuyer programs in multiple languages, provides one-on-one counseling on economic and housing-related issues. As a multilingual communicator, Spanish and English, Kathy serves on several nonprofit boards in the city of Lowell, including mine, and I'm very honored. I'm very fortunate to get to work with Kathy. She's an alumna of Public Matters. She studied nonprofit management. She's currently in the LEADS program that's hosted by Harvard Business School and is taught by Harvard Business School faculty. She's also currently enrolled in the Institute for Nonprofit Practice, the Core Management and Leadership Program. And Kathy is a lifelong resident of the city of Lowell. So it's my pleasure to welcome Kathy to kick us off as our first speaker.
Thank you, Isa. And I am the one that's proud to be on the CHH board or CHH family. Yes, number one, I am the best thing about that bio is that I was born and raised in Lowell, and I care deeply about this city. And I care deeply about, you know, my BIPOC family as well as my allies. But, you know, it's just an honor to be here. I'm super excited that, you know, the Lowell Community Health Center has put this together and focused on people of color and, you know, what they're thinking and giving them the space at the table to speak today and throughout the series. So I hope that, you know, the people that are here today can join the other series as well. So I just want to say that, you know, It's okay to cry. That's a form of self-care. It's okay to be upset and just express your emotions and talk to your friends and vent. You know, this has been a long journey for everyone, right? But the underlining thing is not just the COVID-19 and the self-care. Isa just, by her saying my bio, I was exhausted myself just thinking, oh my God, what am I doing? I'm doing all these things. But as a person of color, you have to do these things when the opportunities are there for you to reach them, because like you said, it's taxing. It can be taxing. And also, I'm sorry to say this, and maybe not everyone can agree, but as a woman of color, you have to always prove yourself 1,000% more than maybe others would have to do. Just being a woman and and someone of color, you always have to prove yourself. So I feel like even today, I feel like I still am trying to prove myself that I belong in this table and I'm at this space because I've worked hard at it and I want to help my people. You know, one thing that I can say is, you know, for self-care is breathe. That's one thing that I've learned with all of these things that I'm doing. I just take 2 minutes of breathing, and it's even emotional sometimes just breathing, because just clearing your mind can do so much, you know, and staying grounded and being humble and reaching out to your family um, is so important to have that family connection. Um, but that's all I have to say. I'm always the type of person that I'll write something down. I'll say that I'm going to do these panels and I'm going to say certain things, but I end up saying whatever I want. So that's why I always go off script. Um, but it's okay to unplug, take a break. Just make sure that you're taking care of yourself first, because if you don't, like my friends tell me, because I wasn't the best advocate for this in the beginning of COVID, my friends told me, Kathy, you're doing too much. You're doing too much. And I had to take a step back. And I'm like, I know I'm doing too much. I'm doing too much. But you just have to, you know, make sure that you're there to continue the good work that you're doing and taking care of yourself and reaching out to your friends and allies. And everybody is hurting at this time. So I'll pass the mic. That is what I have to say. And then I'll go back and think about things I didn't say that I should have said. Thank you.
Thank you, Kathy. Absolutely. You know, these are the days to go off script. We're all living in an off script time. It's my pleasure to introduce next Esther and Ganga, who's the Associate Director of Nursing at Lowell Community Health Center. Esther is a wonderful human being. She's one of the associates of nursing at Lowell Community Health Center in the Adult Medicine Department. She's worked at the health center for over 10 years in various capacities. Esther is one of those diamonds that you don't often see in the health center picture, but who's been leading and who's been committed to the work of the health center for a long time. She's a leader in the organization. She relocated to the US over 12 years ago. And prior to her career in nursing, she worked in the field of education. She's passionate for her community and its development, especially for young adults and women of color. And this is my favorite part of Esther's bio. She's the mother to Flo and Derek, who rock her world. So join me in welcoming Esther to the panel. Think you're on mute, my friend. There you go.
Yeah, that was unscripted. Thank you so much, Isa, for that introduction. I honestly say that Flo and Derek mean everything to me. So I'm delighted to be here and very proud to be part of Lowell Community Health Center to be part of this discussion. And as Kathy said, I also had a script. So Kathy, I'm also going off the script because some of the things that we need to talk about, I've been very passionate about. And if you think about what has happened this year, as a woman of color who relocated here 12 years ago, it's almost like double tragedy Because one of the things that I experienced as a nurse, I saw firsthand what it means to have inequity. I saw firsthand what it means that a Black woman who is about my mother's age is locked in her place. She has nobody to attend to. She has no other sibling around who can take care of her. And she was COVID positive. And I remember having that discussion with another employee at the health center. And it got me thinking, that's a big problem. And so when we're talking about health and wellness, COVID-19, of course, has made it made it worse, and it has made us at least a little bit aware of that gap that exists between the people that have it and the ones that don't. And then worse off, the people that have also immigrated to this country, because their perception about health, their perception about wellness is very, very different. So in talking about myself, how did I take care of myself? I had to go to work every day. Initially, I actually thought the building would talk to me. And so one of the things I learned to do was actually get off my desk and go over to my colleague and tell her, I think I'm hearing voices, right? Because really it was tough to just be alone. You have nobody else that you can talk to within the building. Everybody is on the phone. So basically just learning to leave my desk and walk over to somebody else and share openly what I feel. I think I realized it was a strategy. And that was a strategy that I also found worked when I had to reach out to my mom back home. Just taking a phone call and calling someone really was very helpful, and sharing the experience that the other person wasn't alone or wasn't alone was really very, very powerful. And then the second thing that I realized is very helpful is connecting to a source. So one of the things that I have really loved about law is that it gives us women of color and women that have also immigrated here a place that you can call home, or something that simulates a little bit of the things that get close to you as a person who has been here. So we have a Catholic community in Lower, and I can't tell you how instrumental it was when there would be messages in WhatsApp about how everybody was doing. And I learned, especially for the young people that I used to meet before, that was miraculous. Just asking auntie, they call me auntie. So they would say, auntie, how are you doing? How is it going? Are you still going to work? And that kind of thing. So I think just again, that level of connection, I think was very, very helpful. And I realized that in terms of health and wellness, I think it is just important. So basically what we're missing through the COVID-19 isolation was just realizing that we didn't have the normal connections that we had. But just having that team of people around felt like I was really at home. And then, of course, I always quote my mother. And one of the things my mother says is, COVID-19 is not like any other disease, right? It is not something we know, we will never know. However, if we remain grounded in the things that we know and just do them every day, it's very helpful. And so for me, my mental health and mental wellness has been attributed largely to my mom, because just calling her every week was enough to remind me that it is COVID-19, but it's going to go. It's going to, if we all just stand together. And so what I learned to do was call my friends, call my church mates, call young people, and just send them a text and find out how they're doing. And I realized that really works. That really works well for us. And I want to applaud Law Community Health Center, because I think I saw a huge effort, a concerted effort, clinical people coming together with whoever is working in the community and discussing what can we do. So they brought a discussion that I don't think I ever had before, that really allowed us to actually think and talk about things that affect all of us. So I think I'm going to, like Kathy, I have a lot of other things that I'm going to say, but I just wanted to share that off the bat. And if anybody has a question on nursing, they can feel free to ask me, because there are those structural clinical ways that you're supposed to do. And I don't know whether part of what I've shared really meets that criteria. So thank you. I think I'm going to pass the mic back to Isa.
Correct. Thank you so much, Esther. You too. I'm so glad you both went off script. because what you're saying is very powerful. And it speaks to what I talked about earlier, which is the isolation that we often experience as women of color, as folks in leadership. So how do we break down that isolation to increase our wellness? It's my pleasure to introduce, last but not least, Maria Ibar, who is the grant writer at the Latinx Community Center for Empowerment. She works as an immigration paralegal at the law offices of Gomez and Palombo, based in Lawrence, Massachusetts. She's a graduate of Amherst College, and she holds a dual bachelor's degree in political science and Latinx and Latin American studies. In her free time, which we don't know when that free time is for all she's doing, Maria volunteers at many local community-based organizations and is a grant writer at the Latinx Community Center for Empowerment. Through her work, she seeks to help build an equitable and inclusive law for all. Please join me in welcoming Maria.
Thank you so much, Isa, for your introduction. I really appreciate it. Well, for me, it's an honor to be here. I think that we need more spaces that allow women of color to talk about the things that affect us, to talk about our needs. There's definitely a necessity in our communities to put at the center our stories. And for us, of course, to be empowered by listening to other powerful women like the ones we've heard. For me, self-care is something that I approach and that I see as a privilege. I do see that many women of color, women that are immigrant, do not have the privilege to care for themselves, to think of themselves, because they're so focused on their jobs, on their children, or keeping up with the house, especially when we put and think about the fact that we also have to deal with machismo. I remember that one time I was invited to this support group that my mom invited me with. And there was a group of women, older women, and it wasn't really supposed to be a support group. It was mostly just like a talk, just people talking. And out of nowhere, immigrant women, Dominican women, just began to talk about the things that affect them. And to me, that was particularly very powerful, because many of them had 2 jobs, many of them had children, and they were just talking about how it's so impossible for them to care for themselves. There was a person that said, well, you know, back in my country, I was a housewife and I didn't really have to do anything. You know, I mean, I just worked in my house and cared for my family, but that was it for me. But here in the United States, I have to work, I come home and I keep working. So when do I find that space for me? And women were saying, you should go walk, you should do this and you should do that. And, you know, to kind of see how we can build community that way, to me was just truly beautiful. For me, caring for myself and taking care and in practicing self-care and self-love is very important. And a way that I do that is by caring for my hair. And the reason why is because even though, of course, hair seems to be something that's very vain, you may say, for a long time, I didn't really like my hair. It wasn't something that I was proud of. It was something that I didn't really think it was beautiful, especially because of of where I grew up in the Dominican Republic, when the standards of beauty are that straight hair is how you should look like. So after spending some time with myself and I was like, you know, I need to care for my hair. I need to be proud of who I am. And my hair not only serves as, you know, as I'm applying all my creams, is not only a way for me to kind of dissipate, but it's also a way for me to connect with my Blackness, something that for a long time has been suppressed, that I've suppressed because of society. You know, in my country and even here in the United States, Black history is not really put at the center. It's usually always invisible, you know? So with my hair, I'm not only hoping to, of course, as I care for myself, but I also hope to inspire other women to be themselves, to love themselves. And I think that's also part of self-care. So thank you so much for this space.
Oh, absolutely. Thank you, Maria. I want to snap and applaud. That was powerful. You all said so much in just a few beautiful comments, and I'm grateful to have heard from each one of you. So I think our next activity is questions for the panelists. So we're going to go into, it looks like, small breakouts. Is that correct, Linda and tech team, for the next part?
I think we can have a few questions from the audience because we haven't had any questions in the chat, or if people want to drop them in the chat, that would be nice.
Excellent.
Yeah.
This is my partner, a little known face in Lowell here. Mercy, helping with the chat and the Q&A. So another one, powerful woman of color leader. Thank you, Mercy, I appreciate it. So we also want to talk about, what do organizations need to do, right? How do our organizations, is one of our questions for the panel. What is your organization, those around you, done to help provide, support your wellness? So feel free, anyone on the panel. Our order has been Kathy, Esther, then Maria. We can continue that for now.
Isa, I'm sorry. I was paying attention, but I got lost in translation. So what was the question?
Oh, no problem. I'm sure I said too much. No problem.
No.
What do organizations need to do to support BIPOC women, leaders in their organizations?
Okay, I'll take it. For me, not just an organization. I mean, I live my life. I've raised my 4 beautiful children that I did not mention at all in the beginning, which I should have started off with that. Okay. And how difficult it is being a woman of color and COVID-19 and working from home. I just want to throw that out there. Although I do have 2 adult children, so I'm not going to lie. I just have 2 little ones at home. You know, just in general, any organization, what they can do in order to support BIPOC people, you know, is respect. You know, number one is respect. That's the way I was raised. That's the way that I raise my children. And that's the way I live my life. Honesty and respect, and just calling things for what it is. You know, people are so afraid of what to say and how to say it. And, you know, get out of your own head, respect the person. Don't reiterate what the person says. That's a microaggression. You know, just go for it. Respect that person's opinion. That's what I would have to say.
Absolutely. What would you add, Esther, or what would you say?
I think for a lot of organizations, like Kathy has said, I think one of the things that we suffer from is isolation and being the only ones, right? And I think part of the challenge is that our history, which has a little bit of, let me not say little, has a lot of trauma. So sometimes we are not successful, not necessarily because we are not excellent and good at what we do, but sometimes because we are dealing with so much more. And sometimes that environment doesn't exist. So I feel that sometimes if organizations can step a little bit forward in trying to create those environments for leaders that are coming up, so that you can give more breadth and you can have more people at the table who are then able to tell you or advise you how to treat their very own. I think that the other thing that I think is very important is, and I'll talk from a clinical perspective here. Now, one of the things that I've found very challenging is that, so our community health center would take in any patient who comes in. Okay, they don't have insurance, they need an interpreter. We do whatever we can to accommodate that patient. But I can tell you how many times we have patients who are frustrated, who are referred for clinical services. They go to a specialist downtown Lower, and that specialist does not have an interpreter to take care of them. And then they will call us and they don't know what to do. And so I think if organizations held others accountable, like honestly, sometimes saying, we're not going to do business with you. If you're not going to support the people that we support, then I think we need to cut off, because that's where you see the highest level of discrimination and frustration. Because anytime you tell me to bring my parent to an appointment because I need to interpret for them, then I don't go to work that day, right? And it's only something so small that you can offer. So I think one of the challenges that I've actually seen, the organizations that take those patients can hold others accountable because they're at the same level. And that way then, if you think about access, then you would have more access for those patients. They don't have to then worry having to go to Boston when they can walk down the street and have somebody serve them, or they don't have to have their daughter who is not even getting into a very good paying job and now has to leave work, and then they are in disciplinary action. It's such a triple effect that people don't actually see and hold those organizations accountable if they can't serve the same people that walk into a door. That's a clinical thing, and it honestly, as a nurse, it's very frustrating.
Absolutely. Thank you so much, Esther. Maria.
Sure. So I think that if organizations really want to put at the center women of color and how they practice and self-care and their health and well-being, I think we need to start having conversations about race and racism and sexism, especially because us as women of color, we have this intersection of identities as as people of color, but also as women. So our experiences are very particular. So I think we need to begin talking about this, bring up, what some of the things that women of color go through mostly, or sometimes is macroaggressions. And I think it's very unfair for us to experience this in our workplace and then go home and try to practice self-care. Sometimes that's not possible because here you are trying to cope with something that a coworker told you or that your boss told you. And I don't think that is fair. So if we really want to promote self-care, we need to begin having these conversations. We need to listen to them, to their needs. What do they want? How can we create an environment that is safe for them? That's not toxic, because even though environments in the workplace can be good for some people, for others can be very uncomfortable. So listening to them and making sure they have what they need in order to practice self-care, not only during their job, but also at home.
Wow, you all, some amazing responses. Thank you. Thank you so much. Mercy, you had a question that you would like to read.
Yeah, so we have two questions. I'll go with the one from Mona. How do you all feel about always having to be the spokesperson and teaching about your equity inclusive environment? Do you feel the business should learn instead of pushing the BIPOC people to run and research? Learn to run and research. So literally run, research so that we come and tell you what to do.
Oh boy, what a question. Let's try the opposite direction this time. Maria, do you want to take that one first, and then Esther, and then Kathy? That's a great question, Mona. Absolutely.
So yeah, it's for me, it's actually different, just because as part of the Latinx Community Center for Empowerment, most of us are women. So it's just one man, but all of us are women of color, which is great. Of course, it creates a very inclusive environment. And when we crafted LCCE, we really put at the center, the needs of women of color. But I think it can be definitely very, it can be a burden and very exhausting for women of color, for people of color, to constantly having to remind people about, what is race, what is a microaggression, to always have to learn. I really see it as free labor, something that I think we should be paid for, because it's just not okay. I think more people need to go out of their way to learn, to read. There's so many books, and they can of course come to us for us to provide some recommendations, but I think people need to learn on themselves. And if they want to have a talk with us, we can. But for us to always be constantly teaching people and providing definitions, it's not fair. I think that if we really want to create something sustainable, everybody needs to get reading and needs to learn.
Absolutely. Thank you. Esther, please go ahead.
So for me, I'm not a spokesman, so I have to say out there, I think part of it because I'm so involved in the clinical work, but I think one of the things that Maria says is, one, I think somebody should be hired to do it so that they are paid for it. And then secondly, Kathy talked about respect. If we just thought about respecting others as human beings, then there's nothing else to learn. There is absolutely nothing else that you have to, because we all know, even when people say they are not aware, and you just say, I want to touch your hair, or I want to do this, or I want to do, you know, you're crossing the lines. So one, it should be a paid position where somebody works day and night to actually find out, and it should be both ways. So this is what we feel, this is what you feel. So can we have that the spokesperson should be there, but I think it should be a paid position. And then beyond that, honestly, the learning should be, personally, I immigrated here 12 years ago. I had a lot to learn, but I didn't have to approach people and ask them, what does your hair feel, right? Or what does this feel for you? It really was learning, observation, and knowing that there are certain things I can't ask somebody because it is offensive. And I think, honestly, that if we respected each other that way, then we wouldn't even need no spokesperson.
Oof, I wish you could be all off mic. I'm sure you would hear clapping and snapping and all kinds of sounds. One powerful stuff. Kathy, do you want to bring us home on this one?
Yeah, so I'm gonna read from, sorry, because I feel like it's relevant, and this is something that I read. So it says, it's okay to break from being the expert all the time. Set healthy boundaries when others call upon you too much to represent your community. Just because you can do something does not mean that you must. You may feel the pressure of so much work to do, yet you feel emotionally and physically exhausted. Pace yourself and care for yourself in the time of intense events. Do not forget your basic self-care, right? So that's what we're here for. So it's true. And I can tell you from my own personal experience, like even the leader, it's the term, like I feel like a true leader is someone that brings another person up from behind. And that is the person that I am. And that's who I want to be. Well, I am. And I still want to continue to be that person and stay grounded. You want to make sure that I struggle with this, saying no to things. I'm always saying yes. And it's not because I want to be that person in the front row. I'm okay with being in the back. Every time I have to speak in the panel, I get so nervous. I stutter my words. I forget how to speak English, you know. Although I speak Spanglish, I wish they would like make that a real thing because it's a real thing. My mom speaks Spanglish. But yeah, I just, it's exhausting. And, you know, people, even if you feel like you're not the most eloquent speaker in the room and, you know, you don't have a bunch of degrees, you still have a voice. I found my voice. Now no one can keep it quiet. What a mistake. That's all I have to offer.
Absolutely. We are all so glad you found your voice. Mercy, did we have another question?
Yeah, we have actually a follow-up question that I think Kathy has addressed a little bit, and that is, how would you balance the power dynamic to give more spaces to other leaders to come up? So maybe Esther and Maria can add to that, because I think Kathy did talk about it.
That is a great question.
Okay. Yeah. Oh, do you want to go, Esther? Okay. Well, I think that, you know, what Kathy said about, you know, bringing up leaders and not wanting to be the only voice of color in the room, it's super important. Because I think what, you know, tends to happen is that there are certain spaces that are, of course, not diverse. And at times, even for ourselves, can be really hard to speak up in these sort of spaces because we're the ones that are bringing the challenges. You know, we're the ones that sometimes are just saying, oh, we're not really thinking about this. And sometimes it's an inconvenience for some people to think about certain things. So to bring up other people with us to the table, to also like push that agenda, it's definitely super important, and it's needed. Many times, when something that I've seen is that experienced leaders that have been there, that are of color, sometimes don't really allow space for new voices to rise. This is not always the case, but sometimes it happens that, like, you're there, but like you don't feel like the leader is really like allowing you to speak up, the person that kind of helped you to get in the place in the first time. So I think that we also need to provide some airspace for other voices to grow and for people to be able to find their own voice. For me, that was something that was really hard. I really thank Middlesex Community College for giving me the opportunity to kind of expose myself a little bit more and to learn and to grow, of course. But, finding your own voice is a process. And, to what Kathy said, being able to bring other leaders is something that a leader has to do and we need to do so we can actually create community and create actual change with unity, of course.
Make sure you all as panelists check the chat. A lot of love and appreciation for you there. Esther, do you want to wrap up this question? An important one.
So Maria, that was a very good point, that ahead of us, there are people that, again, I'm going to quote my mother, that allow us to sit on their shoulders, right? And they allow us to see what is ahead of us. I was in a class with Isa. I was recommended by Mercy. I was recommended by Linda. And I never knew them, but I think them being ahead of me and letting me know what's ahead of that and what I can be and become, I think becomes very instrumental. So I think as leaders, whatever opportunity we have to lift one of us, I think is very, very important. One thing I know is very challenging because I do a lot of interviews. I see a lot of shying. There's a lot of fear. There's a lot of poor preparation. And I think one of the dream things that I would love to do is to actually, outside my work, be able to start actually training people of color to be just prepare for interviews, because we fail at that point. A lot of them just fail at the presentation level. And so the opportunities exist and they're there, but until they come and they are brave and bold enough, then it will not happen. But I really want to applaud the leaders that have given me the opportunity to be where I am today, all of them, because I know a lot of people took my hand and said, you're going to do it, you can do it. But hopefully that we can also be able to start giving back. And I think that's a challenge I'm also taking today, that we can also give back to those ones that are afraid, that never come forward and fail at the entry point. And so they never see the light of day because of all the things and stigma and fear that we face out in the community. Thank you.
Absolutely, right? People call it lift as we climb. I know the INP talks about that phrase a lot, right? How do we make space and bring others along with us? I also want to say in our organizations, don't stop with one person in particular roles. Sometimes in organizations, we get one person and, oh, okay, we're good, right? With our right, it's a check mark, exactly. So to our organizations that surround us, help create those pathways. Even as you said, Esther, helping people practice interviewing, right? Helping people practice those other leadership skills, I think is so powerful.